I'll get it. Thank you.
You just briefly what the principles of conditioning are? I know you said like they can be the seeds of addiction, but like can you just briefly do?
Yeah, just the terms that I would use. So the question is around principles of conditioning, and I like cataloged as if they are like stages or some type of like principles, in the sense that like this is and this is to me a rather controversial kind of part to it. Words that we use like grooming or manipulation or incentivizing, habits, conditioning in the sense of habit forming. What are the conditions in which that create habits? Does that make sense? The principles of like when people are in a vulnerable state, they're more likely to go on their autopilot, and that autopilot is habit. And so when we're on autopilot, we're dissociated, we're living dissociated, we're just kind of habitually going over things, and you start to see OCD, you start to see these types of kind of behaviors where repetition is kind of playing out. So the principles of that are the conditions that create the habits that people have to start to decondition from. And that's where like meditation is a form of deconditioning, deconditioning chaos and creating calm in their life. Does that make sense?
Yes.
Okay. Sure. And it is relevant because historically, I mean, this is what were some of the highlights in psychology was to find out that like if you rang a bell before you gave dog food, when you gave the dog food, it would start to salivate beforehand, Pavlov, right? And so classic conditioning, well, when we talk about addiction, we talk about operant conditioning, meaning that we are conditioned to the opposite. It's still conditioning. You're still having a relationship with a thing that you are becoming, I guess. You're having repetition, connection, and repetitive exposure to something over and over and over and over again, and that you're creating relationship to it. Even if it's inanimate, object permanence was another thing in psychology of, not object impermanence, but object relations, like how we form relationships to like stuffed animals and stuff like that. These things, they help us get through. And so like, where psychology, as I said a little earlier around like, being kind of invented or reinvented, I guess too, Freud listening to people tell stories of trauma and witnessing experiences of shifting and switching in as far as a dissociated thing. Why it isn't one of the symptoms of addiction is Dr. Jekyll and Mr. Hyde is beyond me, but like that is classically known, but that is not one of the symptoms of addiction. Right? There is one that's close, is when you don't get your drug, you have a strong reaction. That is a dissociative effect, right? That kind of catalogs it. But like to really be able to say like, no, this is another side to you really helps parents know who they're talking to. Because parents will say to me like, yeah, I feel like I'm talking to a 15-year-old or whatever. Like, because you are. They're not there because the drugs have taken that part of their brain out. That's who you're engaging with. The classic song, like let's get retarded in here. Like that's basically let's take away the outside and just go inward and have like our adolescence playing around or whatever. And that's what we see. Regression in that sense. Now, this was happening early the turn of the century, in the 1800s, when Freud was kind of batting around his ideas. I think his first book was published in 1890, right around the time of William James, who wrote a book on mystical experiences that was like the foundation for a lot of lot of our learnings about, what were religious experiences, and we're, 200 years they were burning women at the stake. Now we're doing psychological research to be able to do, religious experiences, and, the classic kind of experience of like the Southern Baptists and going up and like, doing things like that. Like, we have answers for those now. Psychology could accept an alternative psychology if it wasn't so invested in its own. But like these traditions, the homeopathy, these types of things, one of the things that I would argue is that what is making drug use traumatic nowadays is the potency of the drug. The more you remove it from its original source, the more it's going to impact the biology. The bigger the wave, though, the more damage it's going to create. We don't need a stronger fentanyl. If somebody creates it, that's telling me how addicted they are to creating stronger drugs that we don't need. It's like having a stronger cyanide pill. Like, why do you need it?
Or wheat.
Or what?
Or wheat. Gluten.
Well, I mean, why change things? I think it's because we have bored chemists. I really think that is a legitimate answer. Mm-hmm. That like need to do something with their degree in order to, and they find a patent or like Teflon. I mean, just watch John Oliver. Like, everything we're doing is wrong, and everything they thought was right is wrong. And when you go into recovery, you go into 12 steps, and they say you at like Teflon being like chemicals. Okay. There's, yes. So there's stages of awareness, and this is, stages of change, stages of awareness. These are helpful for people to know where they're at. And it's helpful for us to be able to kind of, the questions that we're getting, are people pre-contemplative? Usually people that are coming to us know they have a problem in general. They may not know what, and how much mental health is impacted by diet. How can we, as any type of talking professional, not comment on the things that are probably injuring them and contributing a lot to their stress and their diet and stuff like that? We can talk about what happened when you were a kid, but like these factors are maybe how much more are the, if this was gone, how much more better could you get? We don't really know that. And plus, whether it's poverty, convenience, and getting people to change those types of habits are major. People have to have a major point of inspiration to start changing everything they know about themselves, everything that they do. But that is what is required for the drug addict to be able to change people, places, and things. You tried changing people, places, and things. That's fucking everything. Right? But like, the alcoholic still has to drink, water or something. Food addictions, these things are really what people are struggling with, whether they can directly name it or not. And so, as I look over history, you also see a wave of awareness, with the PTSD diagnosis, and the third edition of the DSM said it was an abnormal response to an abnormal event. Now they're very careful about writing dumb things in this book. And, saying that gay was a disorder. Like, they're very careful because they know that we will hold that against them as like consumers. And right along the way, every step, there's another one: non-addictive opiate, chemical imbalance, and these types of things. So they're telling us their stage of awareness, or at least clinically, how developed they are or aren't. They shouldn't have made recovery a profession. I'm telling you, like, this is the truth that recovery brought. And here you go. You're pre-contemplative if you are thinking that 1 + 1 can only equal 2, or however we want to put it. The action, in one of the papers that I wrote, I summarized it as best as I could, but the difference between ethics and morals is action. And when we look at like ethics being equated to law, or what is right by some type of societal norm. Gabor Mate wrote a book published, I think 2022 or 2023, on the myth of normal. There's also Thomas Zazars or something like that from the 50s. He was an outspoken psychiatrist who was saying, be careful about equating, mental health to people, because that is going to end up being the justification for calling people crazy. That's going to end up being the justification for being able to these things start to become a reality. What I do feel my work highlights with the MESA is the ability to be able to have a much clearer understanding. If you combine it with a brain, it is what it is. But being able to let people know that like crazy is how you feel, not who you are. Right? There's a different source of our knowledge, qualitatively or quantitatively, left brain, right brain, heart or mind. Right? These are different sources of our brain. Lived experience is the quality, right? If you have learned to, like, you know, a lot of times, like, you know, some of the bigger chains out there, they buy their appliances and they have less quality products in them, like, you know, washers and dryers or lawnmowers. The bigger chains, they get a bulk discount. They have factories that specifically build for those types of things, and they are usually a little cheaper. They usually have something that will break and they become like throwaway lawnmowers or whatever. Like, that is like a consumption kind of thing that we can just, you know, it's just easier to buy another one than to replace the part. That is a very convenient type of system, and it's very dependent. And I forgot why I was talking about that. Action, I guess. When laws, ethics, and morals are confused, we have to go to the research, the literature. What the literature has in it is developmental stages of also the minds that would be thinking in a pre-contemplative way or a contemplative way or a pre-preparation way. Meaning that when we are dealing with rings of the tree and we see different ages of us, people get stunted at certain ages. It's called arrested development, and where trauma can kind of freeze somebody at a stage. A part of them goes forward, a part of them stays there and can become kind of like the predominant, you know, self. And that may be how they're operating, but their thinking is very similar in that way too. And so Kohlberg, a researcher in the 70s, did a moral development study for his dissertation and highlighted that morals and ethics are equal in the sense that they're like parents. Law is at a different stage, or probably more equated to what is another researcher, Jean Piaget, who studied infant development and up to a certain age. And he talked about cognitive processes like peekaboo, kind of object permanence, you know, being able to see these things or not, or concrete thinking, black and white thinking, all or nothing thinking. And then you get to more abstract levels as we develop in age, right? So he kind of marked those out first. So when we look at like what stages of aspects of self we're talking to, we have to be able to talk to different ages and understand that the brain process that they have is what all they have. They're trying to get it from you. They're trying to get the other level and, to, in a sense, grow the other way of thinking, the abstract thinking. If they only have black and white, they're asking you to help them see in color, you know? And when we start giving, you know, in a sense, people psychedelics, they start to see in color, you know, like a literal kind of a thing. Or people start taking them, they start to see in color. They start to open their minds to the experiences that aren't black and white. And that starts to show them a whole new world. They open up and life actually becomes life again, interesting and fun and wanting to be curious and stuff like that. So it is tough to measure this. Recovery also has some of these as well. So you can kind of test the quality of people's relationships based on what they say and what they do. So ethics is what they write down. What they do is something different, right? And to be fair, probably we all do that, you know, to like not tell the whole truth and nothing but the truth. Because like, yeah, they're probably skimming some off the top, and okay, we might as well, you know, skim something off to be able to, make it even in a sense. That's not the moral thing to do, though. The moral thing to do is, right thing when nobody's looking, right? That's the standard in which recovery is required for people who are recovering from addictions, if they're in recovery from addictions. Otherwise, then they can be seen as not. And that's how we differentiate between, people's words and their actions. And these things are invaluable when we are trying to see if the person feels right for a healing experience. Is this the right time for them? People are usually coming to us out of desperation. Maintenance healing is a lot of what we would be supporting. People who need to learn aspects of healing, but that are not in crisis, that are not really in a diagnostic state. Psychedelics, adding a drug to a disabled state is not going to be recommended, no matter really what, unless it is like, a prescriber that's saying, have a benzodiazepine and like have your nervous system calm down and then go talk to somebody so you can learn that your body isn't going to be caught in that at all times. Like you can have another experience. Now, if you can't you can't prescribe anything, none of us here can, but if people are like, can I take CBD to help myself with my anxiety? That's how they sell it. That's what they say it does. And literally I started doing a tradition with my kids of having like tea, but having like CBD in it and having some mint, and they're making tea. And my daughter, obviously without knowing anything about it, she's like, I feel much calmer. She's like, it's nice, and it happens physiologically. This was taken out of our food because of stupid laws. It used to be a part of our main diet. It used to be everything we made ropes from. Like this used to be a major part of our life. We would have been handling it on the farms. The cows would have been eating it. These things would have been a staple in our diet. It's not there now, which is a major reason why people may be having anxiety and stuff like that. So when we are looking at like levels of awareness and being able to assess who is where, I think the public are generally looking for, people, professionals to be moral when we are being legally held to be ethical. When ethicals are just really ideas that we should follow 21 rules, but one will do. Right? And there's nothing necessarily wrong with ethics, but what if the laws are illegal? Like psychedelics being illegal at this point. The research is clear. And even like daylight savings time, this is how how serious, like if they're going to take this away because the research is so clear, but yet it has taken this much longer to happen. Right? Even with the prohibition, I don't know how long it took for them to make alcohol illegal, but I think it was 24, 26 or whatever. It didn't get ratified until 1936 to have it overturned. It took whatever, like 12 years later. And meanwhile, like, yes, one of the main things that in a sense, the government, learned is that like, with Al Capone is that like, all of a sudden tax laws and like these things became, bureaucratic. You started to be afraid of the IRS. Before they were like, whatever, IRS, but now they actually had some like standing to be able to, influence, people's, lives, and, freedom being what it is. Saying that people can't sell alcohol and or don't have the right. The issue that I think a lot of people were having at the time was the potency of it. They were not used to distilled alcohol. People were blowing up their bathtubs, and there was no. And do you need regulation? I don't know. I at that time maybe you couldn't. It was too big. Now maybe we do need more of it, but taking away people's choices and rights is not going to end well. And when people are at certain stages, if they're thinking in black and white, they may think that you're taking things away from them, like their toys. That's going to give a strong reaction. And that's really what that symptom of addiction is when their drug is taken away, you see a stronger reaction than what you're expecting. That is often like what looks like bipolar. That's what often looks like anxiety or multiple personality disorder, now known as dissociative identity disorder, of which is infused into the addiction Dr. Jekyll and Mr. Hyde. Like, these things were obviously clinically, these things were happening, but they haven't been named by name. I think when we actually name it, we have to tame it then. And if we're going to tame addiction in any kind of sense, we have to have an accurate definition and know what it is. Start not doing anything. Start meditating, start being with yourself, start listening, start, put your, cotton in your ears or whatever, cotton in your mouth and open up your ears type of thing. And when we do that long enough, we get to a maintenance stage because we've learned that there's probably more power in silence and or being an observer. Even there, though, we can't get comfortable there. At some point, we have to take action, speak up against things that are inherently wrong or that are contributing to the continuation, progression of trauma focused care. Okay, well, when I look at the symptoms of trauma, I literally see the definitions of what dissociation is doing. It is describing how dissociation works as the symptoms, how we're labeling it as intrusive or whatever, but like those reenactment processes, those types of things are literally outlining dissociation. So trauma is really capturing dissociation as a clinical definition, right? And when we start talking about the solution, and meditation being a solution is about a dual attention state. It's about, can you be dissociated and be here today? That's really what that means. Can you be here and not here? And from a brain spotting or trauma resolution perspective, that is what starts the shift in the altered states of consciousness. It's when people start to shift towards being in kind of a, what we know as a theta alpha kind of state, from a beta state and a protective state, a doing state, into a more being state. Start playing music when people start taking a medicine that actually helps them calm down. That doesn't mean they're going to get calm. They have to their other part has to give permission to not be on high alert. Right. And that's why when we take medicine in any form, I don't care if it's prescribed or not, we want to ask permission that the body is is this what we want? And have a consensus. Don't take something if you really don't have permission from yourself to take it. It's when we cut on autopilot with drug, that's when it starts to take on a life of its own, which is really the definition of addiction. So when we start to get to dissociation-informed care, we start to see how it is the next extension of trauma-informed care. And then I would say somewhere in there, I wrote something about addiction-informed care as something that we need to think of next, because under what conditions do traumas occur? It's usually when somebody's needs aren't getting met and they are violating some type of social contract, and it has, damaging consequences, right? And so the addiction is crossing that line into pathology. And this is what we mean by borderline. They are borderline that line of crazy and not, right? And that's when people are walking that line. We often are crossing that line. And even as healers, wounded healers ourselves, we are crossing that line often as well. We want to be able to know where we are and how to get back. That was our practice with medicines. So I'm teaching people to work with medicine so you can, in a sense, learn who you're working with to teach them how to do it and how they need to do it. Because there are implications as to what medicines that they're doing and how they're doing them and stuff like that. We're not telling people to do medicines. They're already doing them. We're informing them how to do them from a recovery standpoint, how to not create addictions, because the system hasn't taught us how to do that, because they are benefiting by keeping us addicted instead of us teaching us how to be on our own and be self-efficient and be interdependent instead of just dependent, right? And so dependence is a stage of growth and a stage of change. Even depression is the underlying mechanism is dissociation. Because the depression is so tied to the nervous system that the shutdown, the dorsal vagal, which there's 3 kind of parts to this vagus nerve that has been kind of outlined, and that the oldest one, the reptilian type of one, is the quickest. and it can drop people and they can be catatonic. So when people start taking medicines, you start seeing what you see in the healing movies of you start seeing people convulse. That's actually them healing. Healing is painful because you're getting the pain out. And so what we know from like animal studies that have traumatic experience, they shake the stuff out after they get chased and they discharge it and they get rid of it. They send it back to the earth. The reason why our stuff gets caught is because we're not doing that. A lot of our traumas are in social situations and we can't just do this. We're frozen into, if we make a move, they'll be like, see, I knew you were lying. Right? And that is socially, it's a lion in the jungle, but because our body is feeling like we're getting attacked like a gazelle, you know? So being able to map out where we are as a field and how this profession in a sense fits into it, and how meditation and other things that I train in, EMDR, brain spotting, trauma resolution methods, really come down to an organic memory reconsolidation process, which is basically the process of moving memories that still feel like they're happening into long-term storage, where they feel like they happened. So like last Wednesday's lunch. That is one of the ways of helping with, memories or topics that people are trying to move past. Sometimes it's a block spiritually, sometimes like a writer's block. You kind of want to, find out what's blocking you from writing this because you want to write it, but like there's something blocking you. Well, it's usually a parts. What we're doing with the meeting area is we are setting up the conditions in which you can connect with the inner world to elicit a reduction in resistance. We often send people to psychedelic therapy because they're treatment resistant to everything else. I had a client come to me once who was trying to fail so they could get onto the trials, to get into the MDA trials. And I'm like, I know what you're doing. I would do it too if I was you. I was like, but like whatever solution you choose, like you have to be willing to take it. You have to if you've ever kind of like bought into something and like it wasn't exactly what you thought, like you have lived experience of like that innocent mind that's like, yeah, this is going to work out great. And I know it doesn't mean it can't. It may be more work than what you were expecting. Sometimes we have to pop those illusions or expectations that we're holding on to. So I'm going to go to my outline here as our visual. So my point in bringing this up is that we have to be able to measure where we are as a society, as a field, as a profession. I think healers are more future oriented because they're seeing the constraints of what is happening today and what is really the problem in the sense of getting in the way of people getting the help that they need. I've been treating people from ketamine traumas for the last 12 years because people are going to it like the drug is actually what fixes them. It's not. The drug isn't what heals. It activates a state of healing within the body, of which is that dual attention state. And you have to be able to be grounded and not hear at the same time. You have to, if you've played a sport, you have to be in the game, but also like above the game and like know what is going to happen. You're going to have to remember every other play that happened before this because you've seen them do that. One time my parents, it was an indoor soccer game and, it helped shape kind of how I thought about the game afterwards. And the keeper, whatever, we were like 12, but they're like, he kept passing the ball right down the middle of the field. And, my dad was just like, just go stand right there. It goes there every time a goal kick happens. And I scored 6 goals. He just kept passing to me and I just kept hitting it in. And it was just like, and I was like, oh, okay. So, but once you learn the game and once you learn that healing is possible, there becomes what is called a generalization effect. You start to be able to apply that you found the solution in something, that you can find the solution in something else. You start to condition hope and instill hope because the outcome. One of my favorite lines comes from Axl Rose saying, from a song, don't damn me, we take for granted that we know the whole story. We already know the whole story. We already know how this ends. Our personal lives, other people's lives, we already know how this is going to go. It's just that we're kind of here just waiting to see when it, and if it happens and how it's going to happen. But like there is a part of us that has a knowing to us, which is our lived experience that is tried and true, which has much more value than the quantitative questioning of, question everything. Well, no, there's some things you really shouldn't question. And for very long, I guess. Yes, entertain it, but don't get so stuck on it that it prevents you from, really seeing what is true, what is in front of you. The forest through the trees. We don't need to count the grains of sand to know what sand is. We don't need to know how much sand there is. We just know that it is. Right? If you're going to spend your life counting grains of sand, and I think of bean counters or that we weren't meant to do one profession only. This is why we have like mail rooms and people they want to break out of there. This is an industrialization, and we're absent of the humaneness and the humility that probably has really gotten us farther than we can imagine. Cooperation is much more important than being right or being in power or having control or whatever. Addiction-informed care suggests recovery-informed care, and that's really what you're getting from me. I'm trying to encapsulate a recovery that is the logical next step after addiction-informed care. Because if it's a double standard, then there's something off. We have words for these types of relationships. And when we really look at abuse and we look at the diagnostics, there really isn't a diagnosis for people who abuse. And I brought this up in another, setting. And, the obvious example is, with like pedophilia or something like that, like there is that diagnosis. And the research on it, I don't question the research or the researcher, but one of the predominant ones from what somebody quoted to me who I trust, but I haven't got my eyes on it directly, but that a lot of it isn't reenactments. That like percentage wise, a lot of the pedophilial reenactments, or at least they can't find them, but it's also like, would they tell you the truth? So like there's a lot of gray area in that conversation. But what I mean by like, there isn't a pathology for batterers. There aren't very many batterer programs. I think it's because we're missing that addiction. And as a person who has abused themselves with alcohol and drugs, like I have an abuser in me in that sense that like I will kill myself to spite myself or others, and as twisted that may be, like that was the state that I was in, right? That made sense at some point to continue to push an extreme that wasn't getting me the outcome that I needed or wanted, but it ended up actually getting me exactly what I needed. It was just that what breaking point was I going to say uncle, right? And apparently I had to take my liver failing and almost dying another time to be able to be like, huh. And actually what it was that woke me up was a beautiful nurse who I woke up to, and she had a ring on her finger. And I was just like, the way that I'm going, I will never get to meet you. I will never offer you anything. And I was just like, that was a very small moment of like realization that like this highway isn't going to go where I want it to go. And I, maybe we all end up at the same place in a sense, but like, I don't have to go the fast lane. I can slow down, and it took a car accident to remind me of that and wake me up, but it woke me up. But it didn't stop me from drinking. I still drank for the next 4 months. But it was at least a seed, and that may be what we get. But when this tree starts to ripen, I'll quote the Grateful Dead again: "Don't shake the tree if the fruit ain't ripe." Same thing with like the healing work. If you're not seeing, the effort, if you're not seeing the fruits of their labor, of which is regulation and like making changes, making small habit changes, making, conditioning new things into their life. And we're going to give them things to condition. And if they do them, then great. If they don't, then they already have their solution that they're working. And it's just a matter of like whether it's healthy or not. And of what? Avoidance can be, yeah. I mean, that can become addicting in that sense, So, the clinical eye that I am suggesting in this is not necessarily a level that is like clinician only. It's about, people's, words and actions. This is where like politicians usually fall short. And this in how much can they do within a system type of thing, but we still have that expectation that people are going to do what they say. Legals and ethics hold people to them, right? Which may be the moral thing to do, but what happens if those things are corrupted? Then morals are all we have left. And I use the example of taxation without representation as like that was the thing that made us revolt against our parents, our parent nation, right? And that was a developmental stage. If you look at the 1700, the Enlightenment era, like we're talking about spiritual awakening. We're talking about enlightenment. These were some of the ideas that are like, I am not going to stand for not having, you're not going to get my money if I don't have a say in where it goes. And just to remind people that it costs $20 trillion for Afghanistan, and I'm sure you guys voted for that. Right? We don't have say. And, I would love to go into the Federalist Papers because that was one of the main arguments. Do we compete with like the nations that are established and be able to, kind of go toe to toe to them and not get run over them by like their economy? And like we didn't get run over by England, and they were obviously the biggest, richest nation at the time, but we won that one through guerrilla warfare. Which did we learn anything from that from Vietnam? No, but nonetheless, we still have to hold true to some of the ideals that we were born from. That becomes the next generation's responsibility. That's at least how it's been handed down to us. So the other thing that I would honor in the traditional aspect is like when you have a good thing, you don't change the formula. You try to keep it as is. When you have a good recipe, you don't play with it, right? And as an example, like, and it can be a touchy subject, but an example of it historically is introducing, formula as an option for subsistence for babies to be able to survive if mothers can't produce the milk or the baby won't latch or whatever. Like that offering was a good thing because it saved a lot of people's lives. It helped a lot of good things. And it solved the relative problem that honestly probably gave more women jobs, as far as like wet nurses. And it probably took wet nursing away as far as an industry, right? But like it also can be a contributing factor to like not being on the skin or like the type of food or the nutrients that are in there that are different than that. Another example is like, when we do a lot of shakes and a lot of food, well, we didn't have blenders 500 years ago. It had to pass through our enzymes in our mouth. There are certain enzymes that break down certain parts of the food before they get to the enzymes down here, of which the enzymes down here don't have, because historically we've been eating food and breaking things down here first, rather than having a pill that just lands in our stomach, and then our food can't break down those enzymes because it's not used to it. And so we're not getting the nutrients from the food, and that food isn't getting broken down, and it's just waste that's just kind of sitting in us. When we change the formula, same thing with like the drug. You don't need a stronger cocaine or crack or cocaine. You don't. It doesn't make sense at some point. But this is what people spend their lives doing, so they can, capture a patent and, make their money and live happily ever after. Right. So when we look at one of the main, using the reference of like I Am, that movie, which is a documentary, which, accurate as what it is. When we look at what's wrong with the world and what we can do about it, my answer is addiction. For both, because addiction implies recovery. When we look at a recovery path and or path of the wounded healer, like we're going to have elements of recovery that are required for us to do that. And there's the literature, mainly who has been a predominant researcher in that is Bill or William White. He produced a lot of, he did a great history on addiction and treatment of addiction. He's older now. I think he's still alive, but he was a powerful voice in starting what is Anonymous People, which was a movie that came out roughly 12 years ago. But it is a reminder of like the importance of recovery in the conversation. And if we're addicted, it's a voice that's not being heard. And they have worked hard to be able to position themselves in recovery to be a part of the stage of the whole governmental thing. But the spiritual stuff is going to, I think has been starting to come from more of like the recovery of trauma healing, from vets, from moral injury, from historical traumas, from racial divides, and these types of social, which kind of becomes our social distractions in a lot of ways. But these things are ways that we are not getting to the core of it. Like, how do we help heal? How do we tear and repair? And that's unfortunately part of the healing process, is tearing and then repairing. And tearing is something that, like, usually people, it brings up pain. They don't want to do it. I don't want to work out. Well, lift weights, you're tearing, and then you take the time to repair. During people's downtime, we're going to give them things to do to be able to help themselves repair and or get the answers to or sometimes even the questions that they really need to be asking. With thinking of like intentions of why people come and ask for help, A, that they assume that we can. B, healing is kind of implied in engaging in a kind of therapeutic process. The intention that people have is to get better, have more happiness, have more fulfillment, more quality of life. Those are pure intentions. Those are honest intentions. Where intentions can get us into trouble when they become expectations. When people are looking for healing, when they want it, and they don't get it, it can be a process of accepting that, like, this isn't a magic pill. Healing is uncomfortable. It's like cleaning your room. Like, you don't want to do it, but you have to. So when people are, activating states of healing or even regulation with like being able to calm themselves down so they can do that rest and repair, that is usually something that is kind of counterintuitive to the world that we're being sold, which is a very do. Some of my more powerful kind of sessions sometimes is getting people to just stop. And I've had, as a brain spotting overview. I've also had people read the book Focusing, which is kind of a precursor to what brain spotting is. And it is very much a somatic experience. And if people working with medicines and any kind of trauma resolution, the need to know where regulation is and to be able to activate positive states or to get out of the negative is really what the drug is going to do. We don't want them to be so surprised that it throws their psyche off. We want to get their permission before we change the music in a sense that may throw them off, and also know that we're coming. So it's with honor that I teach the meeting area screening and assessment, because it's what I and my clients have found over the years that really let them know that, like, this is where we need to deliver, the treatment or the healing. The parts of self that are wounded that come out when we're fighting with our partners is the part that has to decide if they want to keep doing that or not. The other part that's bringing them to therapy, saying, here, fix my kid, is like, it can also have to kind of say, like, okay, do you need to do it like that? Like, do you not understand that, like, what you're doing is hurting this? Like, even I could make another meme about like family therapy. Like, we should all be in family therapy before we get to individual therapy. But you know why we're not going to family therapy first? Because nobody will show up. I think it's best practice is to start family therapy, but that's not going to happen, because like we don't even want to go to holidays a lot of the times.
Because I'm a family therapist.
Well, that's true too. I mean, and I as a person who has done substance abuse treatment, I'm always amazed at what drug court thinks that I can do to help this person stop doing a drug. Like, you can't stop dissociation. And if addiction is that form, like, you can't stop it. The only thing you can do is, like, get to know it and let it kind of like fizzle out or mature out. And that's why developmental healing is so key. And that's why it's really ironic to me that, like, it's not a disorder. And I'm not saying it should be, because then we're diagnosing normal, and then they're going to have all of our data, and which is what they want. So, I mean, but it's not what we need. So that's a little bit of the historical context I wanted to capture in these topics. Let me stop this.